Hi, it's Professor Tim Roberts here, and I'd like to discuss with you some thoughts about how we approach intraocular lens choice. Once the decision's been made to proceed with cataract surgery, the next major discussion is what type of intraocular lens to use. We now have a range of different lenses, from monofocal to EDOF to trifocal, and sometimes the discussion around this can be a little bit confusing or challenging. First of all, there's no one best lens. All the lenses we currently use are world's best technology, so it's more matching it for an individual person, what they want and what they're willing to trade off. The second thing is, a compromise or a trade-off is not a complication, and it's not a problem with the lens, it's a reality of the technology of the lens. So just as much if we buy a sports coupe, we accept and understand that you can't put two lots of golf clubs in the boot. If that's what you want, you don't buy a sports coupe. So similarly, we'll talk about the realities and the compromises of the lenses, but it's important to understand that that's the package, that's the technology. And the third concept is what your husband, wife, neighbour or best friend had implanted in their eye doesn't mean that's the best lens for you. And you may find that either the anatomy of your eye or what you want in terms of lifestyle outcome with vision will be different to what your friend had. So three things: there's no one best lens, compromise or a trade-off is not a side effect or a dirty word, it's a reality of the technology, and one size doesn't fit all. So if we have a look at the lenses, we have the monofocal lenses, and they certainly give the best quality of distance vision in all light conditions. However, the trade-off or compromise is, as you come into a computer or using your phone, you'll be needing reading glasses all the time. Then we go to the other end of the spectrum, and the trifocal lenses. They absolutely give you the best chance of having reading vision without glasses, but with a reasonable distance vision and with a good computer distance as well. The reality is, though, is that the technical design of the lens that gives the three focal points also means that you can get some glare and halos and starbursts, particularly driving at night. You need a good quality tear film, so if you have some dry eye or irritation with your tear film, that can affect the quality of vision. And you need a good bright light to make it work. So when everything's going for you, this gives very, very good near and intermediate and distance vision. But again, you have to work your motivation out. If you're not overly fussed about an occasional use of reading glasses for small print, and you feel the glare and halos, particularly driving at night, might really annoy you, then that might influence your decision. Not that it's a bad lens, you just have to choose what's best for you. The current extended depth of focus, the latest generation lenses, are giving very close to the quality of distance vision of a monofocal lens, within a couple of percent, but they are giving a really good range of general lifestyle vision using a computer, and many people can use a smartphone if the font's knocked up. Now, I don't promise reading glasses. I think you need to assume for small print, if you're doing a lot of reading, if it's dim light, you might need some readers, but we're getting very good range of vision, quality of vision, very similar to a monofocal, and similarly the unwanted visual side effects, such as the glare and halo, very much reduced with an extended depth of focus lens. So for many people, we're now finding that the extended depth of focus lenses are giving a very good range of lifestyle vision with high quality sight throughout most of the day. So hopefully that's been helpful in going through some of the concepts, how we look at the technology, what the different technologies can do, and allowing you to work out what's going to be best for you, where your personality fits, and knowing whatever you're going to do, you're going to be better. It's just what's going to be choosing the best lens and the best technology for your personality and for your expectations.